Okay, we go to the 5 transporting points. Jingwell points LI1. Location LI1 is on the index finger, point 1, tuned from the radial corner of the nail. How to find? This point is located where 2 tangents bordering the nail of the index finger medially and proximally cross. Approximately 0.1 tune from the corner of the nail. Needling 0.2 to 0.3 tune vertically or obliquely in a proximal direction. Avoid needling the perineum. For acute disorders, pain, inflammation, prick to bleed with needle, lancet, or 3-edged needle. For the action indication, LI1 expels pathogenic factors and opens the channel. It frees the senses. For the special features, Jingwell point, it is a metal point, bend point in 5 phases, entry point according to some authors. As a well point, this point is effective in excess patterns to remove obstruction quickly. Hence, its use in the acute stage of wind stroke, combined with all the other well points of the hands to subdue interior wind. This point clears both interior and exterior heat, so that it can be used in exterior attacks of wind heat invading the lungs' defensive cheek portion, especially with sore throat, as well as in case of interior heat in the large intestine. Its action on the eyes is limited to cases of exterior wind heat invading the eyes, such as in acute conjunctivitis. The explanation of acupuncture points recommends contralateral needling of LI1 for eye problems. The same text says that LI1 also benefits the ears and treats tinnitus and deafness. Besides clearing heat, this point can also expel wind and cold from the channel for the treatment of painful obstruction syndrome of the shoulder. It can be used in this way as a distal point to clear the channel. If the problem is caused by wind and cold, Moxa cones can be used instead of needling. As for lung 11, and for the same reason, Shang as metal. The large intestine also pertains to metal. LI1 is the first point of the metal yang channel, hence the name metal yang. Summary, LI1 is for large intestine heat, eye and ear problems. It also extinguishes interior wind and promotes resuscitation. It removes obstruction from the channel, elbow, and shoulder pain. The term Shang in the name of this point is the note associated with the metal pace in an ancient musical notation system, while Yang denotes the Yang channel and serves to differentiate this point from lung 11, the lesser Yang. LI1 is the metal point of the large intestine metal channel. As the most distal point of the large intestine channel, LI1 has an urgent effect on resolving heat, swelling, and pain on the opposite end of the channel, most frequently due to the attack of wind heat or accumulation of fire poison. According to the Ode to Elucidate Mysteries, the root of the SHANGYANG mean is LI1 and it knots at LI18 and LI6. This statement emphasizes the special affinity of this point for the ear, which is reached by large intestine loop connecting channel from LI6, reflected in its indication for tinnitus and deafness. In addition, the large intestine primary channel traverses the lower part of the cheek and enters the lower jaw, while the large intestine divergent channel ascends along the throat. LI1 is therefore used for disorders of this region characterized by severe and sudden swelling, heat and pain, for example, toothache of the lower jaw, throat, painful obstruction, and swelling of the submandibular region. The ability of LI1 to dynamically clear heat has a wider application in the treatment of febrile diseases, and especially malaria. In common with the other Jingwell points, LI1 is used to revive from collapse and is indicated for loss of consciousness from wind stroke. A branch of the lung channel terminates at LI1, and as the metal point of the young metal channel, it is indicated for fullness characterized by Qi stagnation in the lung, which may first radiate to the lateral costal region and give rise to dyspnea and coughing. In respect of this ability to clear fullness from the chest region, LI1 is typical of the Jingwell points. Finally, the large intestine muscle and divergent channels both connect with the spine. And LI1 is indicated for pain of the shoulder and back, which radiates to the supraclavicular fossa. Thank you for your attention.
Let us now discuss triple burner 4, Yang pool, a source yuan point. Location on the dorsum of the wrist, above the wrist joint space, or the dorsal wrist crease, in the gap between the tendons of the extensor digitorum on the ulnar aspect and the extensor digiti minimi muscles on the radial aspect. How to find triple burner 4? As the location of the dorsal wrist crease varies, the wrist joint space should be used for orientation instead. By moving the patient's wrist in a relaxed way, the joint space becomes well-defined. Triple burner 4 is located slightly laterally to the midpoint of the joint space in the depression between the tendons of the extensor digiti minimi muscle, continuing to the little finger on its radial aspect, and the tendon of the extensor digitorum muscle on its ulnar aspect. The tendons of the extensor digitorum muscle will become more pronounced by moving the three middle fingers. Located on the same level but radial to the tendons of the extensor digitorum muscle is EXUE3, which is an extra point. Needling of triple burner 4. 0.3 to 0.5 zone vertically or slightly obliquely in a proximal direction or transversely subcutaneously deep to the tendons towards the radial aspect of the wrist. Actions or indications: clears heat, opens the channel, relaxes the tendons. In Japanese acupuncture tradition, triple burner 4 in its function as yuan source point is used for deficiency syndromes. Special feature, yuan source point. Triple burner 4 has many different functions. Firstly, it relaxes sinews and removes obstructions from the channel, which means that it can be used to treat painful obstruction syndrome of arm and shoulder. It is also very effective for headaches of the occiput deriving from exterior invasion of wind. The triple burner, and particularly the lower burner, is in charge of transformation of fluids, and this point can stimulate this function whenever fluids are not being transformed properly and dampness accumulates in the lower burner. Triple burner 4 is particularly effective in this connection, combined with bladder 64. The combination of these 2 points stimulates transformation and excretion of fluids in the lower burner very effectively. So remember the combination, TB4 plus bladder 64. The word pool in this point's name confirms its effect on body fluids. Triple burner 4 regulates the function of the stomach and tonifies the stomach, especially in conjunction with stomach 42. The combination, stomach 42 plus TB4, is very effective in tonifying stomach and spleen and giving energy if the person is very tired. These points are in a relationship with the original Qi. In particular, according to the classic of difficulties, original Qi arises between the kidneys and spreads to the internal organs via the triple burner, so that the triple burner is like the ambassador or intermediary for the original Qi. This point is therefore not just a source point, but the source point of the triple burner, which is the intermediary for the original Qi. Triple burner 4 can thus be used to tonify original Qi in all chronic diseases when the kidneys have become deficient and the person's energy is greatly weakened. Because of its connection with original chi, triple burner 4 is also connected with the penetrating and directing vessels and can be used to regulate their chi and blood. It is therefore used in irregular or painful periods and amenorrhea. These last two functions are derived from the Japanese tradition of acupuncture, as Chinese texts do not make any mention of a connection between TB4 and the original chi and the penetrating and directing vessels. Triple burner 64 regulates the water passages of the lower burner when used in conjunction with triple burner 4. So to summarize, the functions of TB4 are as follows. Removes obstructions from the channel, so very effective for wrist pain, neck ache, pain in the shoulder and arm, redness and swelling of the wrist. Benefits the ears, so for tinnitus, deafness, and earache. Regulates lesser yang, febrile disease, alternation of feeling of cold and feeling of heat, and malaria. Promotes fluids transformation, so like swelling of the legs, urinary difficulty, urinary retention, and edema of the legs. Benefits original chi, so good for tiredness, poor appetite, backache, weak knees. Tonifies penetrating and directing vessels for irregular periods and amenorrhea. The classic of difficulties says, the Sanjiao is the envoy of the original chi. The places where the original chi resides are known as the Yuan source points. This passage therefore implies both that the original chi resides at the Yuan source points and that the Sanjiao is a transmitter of the original chi. As the Yan source point of the Sanjiao channel, therefore, there is every reason to expect that SJ4 would be an important point to strengthen the original chi in the treatment of deficiency diseases. And triple burner 4 is used for exactly this purpose in the Japanese tradition of acupuncture. It has also been suggested that SJ4 is effective to regulate the conception and penetrating vessels in the treatment of disordered menstruation. Examining the classical Chinese records on the use of SJ4, the following observations may be made. It appears in a very few traditional combinations. There are very few indications or combinations reflecting its effectiveness in tonifying deficiency, and it has no gynecological indications. It is interesting to note also that SJ6 rather than SJ4 is indicated for blockage of the conception vessel in women. In clinical practice, SJ4 is principally used for local disorders of wrist joint, including redness, swelling, weakness, and pain. In learning the names of the points of the yang channels at the wrist, it is helpful to remember their similarity. Like for LI5, Yang Stream, SI5, Yang Valley, and SJ4, Yang Pool. Thank you very much for your attention.
Let's now discuss pericardium 6, or the inner gate point, a loop connecting point. Pericardium 6 is located tooth-shown proximal to the anterior wrist joint space, which is the most distal wrist crease between the tendon of the palmaris longus and the flexor carpi radialis muscles. How to find pericardium 6? As the location of the wrist crease varies, the wrist joint space is a more reliable reference point. It can easily be palpated by moving the patient's hand in a relaxed way. From the center of the wrist joint space where pericardium 7 is located, measure tooth-shown in a proximal direction and locate pericardium 6 between the two tendons, which become more pronounced when the fingertips are pressed together. If only one tendon is visible, this will be the tendon of the flexor carpi radialis muscle. Pericardium 6 is located on its ulnar aspect. Or we could also use the quick method. So how to do this? From the center of the wrist joint space, glide in a proximal direction between the two tendons. The skin will begin to form a bulge in front of the sliding finger, which will come to a halt at pericardium 6. Triple burner 5, which is tooth-shown proximal to the dorsal wrist joint space, is located opposite pericardium 6. Pericardium 6 is needled 0.5 to 1 tune vertically or obliquely in a proximal or lateral direction. Caution should be exercised in reading this point as the median nerve is located directly below this point. For its actions and indications, pericardium 6 calms the shen, unbinds the chest, harmonizes the stomach, and opens the channel. For special features, PC6 is the luo connecting point of the pericardium meridian. It's the opening or the master point of the yin wei mai, the Gao Wu command point of the thorax. It is also the main point for nausea and vomiting and a very important point. Pericardium 6 is one of the most important points of acupuncture with a great number of different functions. It has a specific action on the chest and can therefore be used for any chest problems. More specifically, it moves qi and blood in the chest and is the point choice for discomfort or pain in the chest due to stagnation of qi or blood. It has a powerful calming action on the mind and can be used in anxiety caused by any heart pattern. It also calms the mind by its indirect action on the liver, to which the pericardium is related within the terminal yin. It can therefore be used for irritability due to stagnation of liver qi, particularly if combined with anxiety from a heart pattern. It is particularly effective in women and is most useful to calm the mind in women suffering from premenstrual depression and irritability. It also promotes sleep. In addition to its action on the heart and liver, it is a major point to affect the stomach, particularly the upper and middle part of the stomach. It subdues rebellious stomach qi and the point of choice to treat nausea and vomiting. It can also be used in most excess stomach patterns characterized by epigastric pain, acid regurgitation, hiccup, and belching. As it is the connecting point of the pericardium channel, it connects with the triple burner channel, and it is effective in treating neck ache on the occiput, especially in women. Women often suffer from neck ache after a hysterectomy, and this point is very effective in treating it. Indeed, the explanation of the acupuncture point says, when the pericardium is empty, there is stiffness of the head. Finally, owing to its relationship within the liver and its action of invigorating blood, this point indirectly connects with the blood of the uterus and can be used to regulate irregular or painful periods. The pericardium influences the uterus due to the connection between the heart and the uterus through the uterus vessel or the baomai. Here is a diagram showing the relationship between the pericardium, the heart, and the liver, where the pericardium directly connects with the liver because both are with the terminal yin. The liver directly stores blood, which supplies to the uterus. Pericardium connects to the uterus through the heart, which is directly connected with the uterus through the baomai or the uterus vessel. So to summarize its functions, pericardium 6 opens the chest and moves qi and blood, which is good for chest pain, palpitations, feeling of tightness of the chest. It calms the mind, so it's effective for insomnia, manic behavior, poor memory, anxiety, fright, sadness, and depression. It moves liver qi, so it's good for hypochondrial distension and pain. It harmonizes the stomach, so it's effective for treating nausea, vomiting, hiccup, belching, epigastric distension, and pain. And finally, it invigorates blood and regulates menstruation. So it's very effective in treating irregular periods and painful periods. Thank you for your attention.
Now we continue with the back transporting points, bladder 28, the bladder chute. For the location, bladder 28 is 1.5 tune lateral to the posterior midline on the level of the second sacral foramen. How to find? The quick method: locate the posterior superior iliac spine, the PC6, from the rima ani. Palpate 3 tune, 1 hand breadth in a superior and lateral direction at a 45 degrees angle until you feel a distinct bony ridge, often superficially visible by a dimple. Bladder 28 is located slightly inferiorly and medially to the PC6. 1.5 tune lateral to the midline on the level of the second sacral foramen. For more detail on orientation in the lumbar and sacral region. Located at the same level are bladder 32 over the second sacral foramen and bladder 53, 3 tune lateral to the midline. Bladder 27 is located slightly superiorly and medially to the PC6 on the level of the first sacral foramen. Needling, bladder 28 is done vertically 0.5 to 1.5 tune. For local disorders, slightly oblique insertion towards the iliosacral joint. For the action indication, bladder 28 regulates the bladder and the lower burner, clears damp heat from the lower burner, removes stagnation, and transforms masses. Benefits the lumbar region and the legs. For the special features, bladder 28 is the back shoe point of the bladder. Bladder 28 is very much used in urinary disorders. Firstly, it expels dampness from the bladder and the lower burner, and it can therefore treat retention of urine, difficult urination, and cloudy urine. It also clears heat from the bladder and can be used for painful and burning urination. Combined with bladder 23 and spleen 9, it is used to expel renal stones. Bladder 28 also generally opens the water passages of the lower burner and ensures that the dirty fluids are transformed and excreted. It is a point that is often combined with bladder 20 to transform fluids in the lower burner and promote diuresis. Combined with bladder 23, it strengthens the lower back and is specially used for pain in the buttocks and sciatica. So for the summary, it regulates the bladder for difficult urination, dark urine, retention of urine, enuresis, and turbid urine. It also resolves dampness in the lower burner, those having swelling of the external genitalia, ulcers on the genitals, itching in the genitals, swelling, and pain of the vagina, swelling of penis. It also eliminates stagnation and dissolves masses for those having abdominal pain, abdominal masses, constipation. It also opens water passages in the lower burner. It strengthens the lower back, those having stiffness and pain of the sacrum, lower backache, stiffness of the lower back, pain in the buttocks, numbness of the legs, and sciatica. Bladder 28 is the back shoe point of the bladder where the chi of the bladder emanates from the interior to the body surface. Its principal action is to drain damp heat excess from the bladder and genital system. The bladder damp heat may be due to invasion of exterior pathogenic factors, damp heat or cold damp, which transforms to heat, especially as a result of inadequate clothing or sitting on a damp ground. Excessive consumption of foods that generate damp heat, like spicy, greasy, sweet, alcohol, etc. Heart fire, which transmits downward via the small intestine to the bladder, liver damp heat, which pours downward to the bladder, and excessive sexual activity or inadequate hygiene. Bladder damp heat typically manifests as painful, difficult, hesitant, and frequent urination with scanty dark flow. As the bladder back shoe point, bladder 28 has a direct action on the bladder foo and is not only a vital point to drain bladder damp heat, but is more widely used for any kind of urinary disorders. The use of bladder 28 is not confined to the bladder, however. It is an important treatment principle of Chinese medicine that damp heat anywhere in the body, and most especially in the lower jaw, in draining via urination. Bladder 28, by its action of promoting urination, is therefore indicated for damp heat affecting the intestinal region, giving rise to diarrhea, and the genital region, giving rise to such symptoms as swelling and pain of the external genitals, genital ulceration, and damp itching, swelling, and pain of the vagina, etc. The second important action of bladder 28 is in the treatment of a variety of disorders of the lumbar region, sacral, buttocks, and coccyx, as well as the lower limb. And it may equally be used for excess or deficient disorders of these regions. It is classically indicated for the treatment of wind, taxation, lumbar pain. For a fuller discussion, okay, see the bladder 26, as well as for weakness of the leg and knee, seminal emission, and diminished chi. These indications reflect the fact that as the back shoe point of the bladder 28 has some action of strengthening the kidneys as far as excess disorders of the lumbar region and legs are concerned. It is specially indicated for back pain, atrophy disorders, and heaviness of the legs due to damp heat. Finally, bladder 28 is able to resolve stagnation in the lower abdomen, abdominal pain, difficult defecation, constipation, abdominal fullness, and to resolve abdominal masses in women, as well as hard abdominal masses. Thank you for your attention.
Now let's talk about the Sinew channel of the lung, or the lung Sinew channel. The pathway. The lung Sinew channel begins on the thumb at lung 11, at the radial aspect of the corner of the nail. Then it spreads along the radial aspect of the thumb and the first metacarpal bone, as well as the thinner eminence. It meets lung 9 and binds at the radial wrist joint space. Travels proximally along the anterolateral aspect of the forearm and reaches the elbow at lung 5 and binds at the biceps tendon. It follows the biceps brachii muscle and the lateral portion of the deltoid muscle. Binds at the anterior shoulder region near the acromioclavicular joint, then continues to the axilla and meets the other hand yin sinew channels, the pericardium and the heart at gallbladder 22, and binds there. Then it continues deep to the pectoralis major muscle and enters the supraclavicular fossa at stomach 12. Courses to LI15 and returns to stomach 12. Then it penetrates the supraclavicular fossa and disperses into thoracic and hypochondriac region and the diaphragm. Clinical importance of studying the lung sinew channel. Pathology: stiffness, cramps, and pain along the sinew channel. Chiffon: spasms and pain in the thorax and hypochondriac region. In severe cases, formation of nodules below the right lateral costal region and distension along the lateral costal region. Indication mainly for P syndromes, or the painful obstruction syndrome along the lung channel. So we mainly use the sinew channel of the lung for P syndromes. The area covered by the lung sinew channel is larger than that covered by the lung primary channel. This explains why the indications of points on the lung primary channel include disorders and diseases of the thoracic and hypochondriac region. So here is a simplified illustration of the lung sinew channel. To summarize, the lung sinew channel originates on the thumb at lung 11, and then it emerges in the region of stomach 12, then travels laterally to the shoulder, anterior to LI15, then returns to the stomach 12 region and descends into the chest, spreads over the diaphragm, and converges in the region of the floating ribs. So this is a summary of what we have taken up. The lung sinew channel originates on the thumb at lung 11 and ascends to bind at the thinner eminence. Then it follows the radial pulse and ascends the flexor aspect of the forearm to bind at the center of the elbow. So that's supposed to be where the lung 5 is. And it continues along the anterolateral aspect of the upper arm to enter the chest below the axilla. Then it emerges in the region of stomach 12 and then travels laterally to the shoulder anterior to LI15. Then it returns to stomach 12 region and descends into the chest, spreads over the diaphragm, and converges in the region of the floating ribs. Pathological symptoms of the lung sinew channel, cramping and pain. So this is usually the site or the location of every time the patient complains of cramping and pain. When severe, there will be accumulation of lumps below the right lateral costal region, tension along the lateral costal region, and spitting of blood. Thank you very much for your attention.
Let's continue our discussion on the accumulation of the Shiklev points with GB35, also called the Yang intersection point. GB35 is located 7 Chun proximal to the highest prominence of the lateral malleolus on the posterior border of the fibula. So how to find GB35? Using the quick method of spreading hands technique, locate GB35 at the midpoint of a line connecting GB34, which is in the depression anterior and inferior to the head of the fibula, and the highest prominence of the lateral malleolus on the posterior border of the fibula, which has a total distance of 14 Chun. GB35 is located 7 Chun proximal to the prominence of the lateral malleolus. Another method, still spreading hands technique, locate GB35 1 Chun distal to the midpoint of a line connecting the popliteal crease and the highest prominence of the lateral malleolus on the posterior border of the fibula. This is a total distance of 16 Chun. For orientation, the borders of the fibula are deep to the peroneus brevis muscle and are often not easily palpable. For this reason, it is suggested to palpate the posterior border of the fibula just superior to the lateral malleolus and then locate the point on an imaginary line running to the head of the fibula. Located on the same level are GB36 on the anterior border of the fibula and bladder 57, which is 7 Chun proximal to bladder 60. Bladder 35 is needled vertically 0.5 to 1.5 Chun. Its actions and indications include clears heat, opens the channel, and relaxes the tendons. It also regulates qi of the gallbladder and calms the shen. Special features, it is the Shiklev point of the Yang Wei Mai, the meeting point of the Yang Wei Mai according to some authors. GB35 is mostly used in acute pain along the gallbladder channel with stiffness and cramp in the leg muscles. As the accumulation or the Shi point of the Yang linking vessel, it affects the Yang channels of the leg. It removes obstruction from the channel where there is swelling and pain of the knee, painful obstruction syndrome or the B syndrome, and atrophy or the Wei syndrome of the leg, cold painful obstruction syndrome, fullness and distension of the hypochondrium and lateral costal region. This point is mainly used for acute pain along the gallbladder meridian with stiffness and cramp of the leg muscles. It coalesces with the Yang Wei Mai, thus reinforcing the gallbladder meridian influence over the lateral costal areas and neck. The role of the Yang Wei Mai in regulating the yang supports the gallbladder's ability to calm liver yang rising, which manifests with emotional lability, tinnitus, deafness, and confusion, and balance stagnation or deficiency of both gallbladder and liver, which will manifest with fright, distension, and pain in the chest, asthma, feeling of obstruction in the throat. Gallbladder fright can affect the heart protector and heart as the gallbladder divergent meridian passes through the chest and connects with PC1. This can lead to anxiety or palpitations, or if heat is also involved, to Shen disturbance in manic behavior. So to highlight these points functions, it regulates gallbladder, it relaxes the sinews, it eliminates wind, removes obstruction from the channels. It is the local point for swelling, pain, and cold of the lower leg and foot. It is a special point for neuralgia or pain following the gallbladder meridian, especially neuralgia or paralysis of the tibial area. It relaxes the sinews, especially around the knee and lower leg. It helps with clarity of vision where the patient is confused or muddled in the mind. Thank you very much for your attention.
Now we go to the 4 C's, DU14, great vertebra. For the location, DU14 is on the midline below the spinous process of the 7th cervical vertebra, the C7. How to find? First, identify C7. Place 2 fingers on the spinous process, believed to belong to C6 and C7, and ask the patient to flex and extend their head. In a fully functional spine and with correct finger placement, C6 will glide anteriorly with neck extension, while C7 will remain fixed. However, if the vertebra below the upper finger does not move with neck extension, the fingers will most probably have placed on C7 and T1. Locate DU14 below the spinous process of C7. Located on the same level are EXB1, the DING1, SI15, EXB, and 0.5, 2, and 3.5 June lateral to DU14. Needling, 0.3 to 1 June strictly vertically to the skin or obliquely in inferior direction with the patient's back straight or flex in order to avoid puncturing the spinal canal. Oblique insertion should only be carried out by experienced practitioners. As in small person, irrespective of their body weight, the spinal canal may be reached after only 1.25 June. For persistent epistaxis, place a cold metal object, for example, a spoon or a cold cloth on DU14, capping on this point for acute colds. For the action indication, DU14 clears wind, firms and regulates the surface, dispels pathogenic factors, clears heat, calms wind and the Shen, strengthens Qi and Yang in deficiency conditions, benefits the spine, especially the cervical spine. Special features, meeting point with all Yang channels, C of Qi point. DU14 can have an opposite effect according to the needling method used. When used with a reducing method, it releases the exterior and is used in exterior attacks of wind heat. This point will release the exterior and eliminate wind heat. It is specially used for invasion of wind heat as opposed to wind cold. It also regulates nutritive and defensive Qi when the person has been attacked by the exterior wind and is sweating. When needled with reducing method, DU14 also extinguishes interior wind and clears interior heat and can be used in virtually any pattern of interior heat. If used with reinforcing method, and in particular with direct Moxa, DU14 tonifies the yang and can be used in any interior pattern of yang deficiency. In particular, it tonifies the heart and kidney yang. For the summary, DU14 clears heat for those having fever, feeling of heat. It also releases the exterior and exterior wind for those having aversion to cold, fever, body aches, occipital headache, and stiffness. It also regulates nutritive and defensive qi, those having invasion of external wind, aversion to cold, fever, slight sweating. DU14 also extinguishes interior wind for those having epilepsy. It also clears the mind for those having depression, tiredness, poor memory, poor concentration. Also, it tonifies yang for those having chilliness, profuse pale urination. The governing vessel is known as the Sea of the Yang channels, and DU14 is the meeting point of the governing vessel with 6 yang channels of the hand and foot. As a consequence, DU14 has a strong action on clearing pathogenic factors from and firming the exterior yang portion of the body. Also clearing yang heat and tonifying qi in yang. When the exterior pathogenic factors attack the body, they most commonly first lodge in the exterior portion, known in the 6 channels and 4-level theories of fibral diseases, as the Taiyang stage and defensive level respectively. Typical symptoms of this pattern are chills and fever, aversion to wind, shivering, and throat painful obstruction. If the pathogen penetrates to the interior, yang min stage or qi level, there will be high fever with agitation. If the pathogen resides between the exterior and interior, Xiaoyang stage, there will be alternating chills and fever, epitomized by malaria. DU14 is a unique in its ability to clear pathogens from all these 3 stages. In the treatise of injury by cold, which otherwise discusses few acupuncture points, recommends needling DU14 in combination with bladder 13 and bladder 18 for the treatment of overlapping Taiyang and Xiaoyang patterns. According to the Ming Dynasty author, SHANGYANG, malaria is an exogenous disease only in the condition of delicate health or overstrain or stress is one up to be attacked by the malarial pathogenic factors. By virtue of its ability to clear pathogenic factors from the Xiaoyang and to tonify qi and yang, DU14 is ideally suited to treat both the root and the manifestation of malaria. DU14 is one of the principal acupuncture points to treat disorder of sweating. Deficiencies, sweating arises either when pathogenic wind attacks the exterior and leads to disharmony of the nutritive qi and defensive qi, or when the defensive qi is deficient and unable to firm and control the pores. By virtue of its ability both to tonify the qi and regulate the exterior, DU14 is able to treat both these forms of deficiency sweating. Night sweating and skin bone disorder are most commonly seen in patients of wind deficiency with heat, and here the action of DU14 is both to control the pores and clear the heat and tonify the deficiency. By Lao, 100 taxation is an alternative name for this point found in the glorious anthology of acupuncture and Moxa and other classics. This name vividly illustrates the ability of Dangshu DU14 to treat deficiency and exhaustion of the whole body, manifesting as lack of strength, the 5 taxation, and the 7 injuries. Another indication that reflects the ability of DU14 to tonify and strengthen the body is shortness of breath with inability to speak. This explains the spiritual pivot, which classifies DU14 along with stomach 9, brain 17, DU15 as a point of the Sea of Qi. This passage states when Sea of Qi is deficient, there is scanty energy insufficient for speech. According to the treatment strategies for assorted syndromes, painful obstruction syndrome is due to deficiency of nutritive and defensive qi and to the space between skin and muscles being open, thus allowing wind-cold dampness to ride the deficiency. Not only can underlying deficiency render a person prone to painful obstruction in this way, but if pathogenic wind damp penetrates the bones and joints over time, may lead to exhaustion. DU14, which is able to expel wind, regulates the pores and tonified qi, is specially indicated for pain of the 100 joints, that is, all the joints, and for wind taxation for chronic painful obstruction leading to exhaustion of qi and blood. Like many points of the governing vessel, DU14 is able to pacify interior wind for those having epilepsy and acute childhood fright wind, and to benefit the entire spine, particularly in the neck region. In clinical practice, DU14 is often needled towards one or other shoulder when neck pain radiates laterally. After ascending to the vertex, the governing vessel descends through the midline of the nose. DU14 is indicated for nosebleed, which does not stop, an indication that mirrors the folk practice of placing a key or other piece of cold metal or cold sponge at the back of the neck to stop nosebleeds. Thank you for your attention.
Now let's discuss the etiology and pathology of common cold and influenza. An invasion of an exterior pathogenic factor is due to a temporary and in relative imbalance between it and the body's qi. So here you could see the illustration showing to us the imbalance between exterior pathogenic factors and the body's qi. This imbalance may occur either because the body's qi is temporarily and relatively weak, or because the pathogenic factor is very strong. So we stress temporarily and relatively because the body's qi is not weak in absolute terms, but only in relation to an external pathogenic factor at a particular time. The body's qi may be temporarily and relatively weak due to overwork, excessive sexual activity, irregular diet, and emotional stress, or a combination of this. When the body is thus weakened, even a mild pathogenic factor may cause an external invasion of wind. So here we can see the diagram illustrating the external invasion in a weakened body condition. A particularly strong pathogenic factor may cause an exterior invasion of wind, no matter how strong the body's qi is. Someone who falls through the ice while crossing a frozen lake in Finland in the middle of winter will suffer an invasion of wind, no matter how strong the body condition is. So again, we have here a figure illustrating the external invasion by a particularly strong pathogenic factor. Wind indicates both an etiological factor and a pathological condition. As an etiological factor, it literally refers to climatic influences and especially sudden changes of weather to which the body cannot adapt. As a pathological condition, wind refers to a complex of symptoms and signs manifesting as wind cold or wind heat. In clinical practice, this is the most important aspect of the concept of wind. Thus, the diagnosis of wind invasion is made not on the basis of the history. So no need to ask the patient whether he or she has been exposed to wind, but on the basis of symptoms and signs. If a person has all the symptoms and signs of wind, which are aversion to cold, shivering, fever, sneezing, runny nose, headache, and a floating pulse, then the condition is one of exterior wind, no matter what climate that person has been exposed to in the previous days or hours. There are also chronic conditions that manifest with symptoms of wind and are treated as such, even though they have no relation to climatic factors. For example, allergic rhinitis, which is due to house dust mites or pollen, manifests with symptoms and signs of wind and is treated as such. Common cold and influenza may manifest primarily with symptoms of wind cold or wind heat. These are the two major types of wind, and most other types may be treated by modifying basic formulae for wind cold or wind heat. Thank you so much for your attention.